Sorry for that. Connection glitch. So now I see we have only 1, 2, 3, 4, 5, 6. We've got only 6 members here. I'm wondering whether we can continue with these ones, because I'm not sure if others are joining. I tried to send a message on the WhatsApp group where all members are. So let's see if they join. But if they don't, I want to ask your advice if we can continue. So let me start with the purpose and approach of this training for the committee members. So the aim of this is to inform the members of the health benefit package committee.
Jenny, wiriwe. Uribuka ya nama nigeze kohereza ya Inabe?
Sorry, can you mute? So I was saying that the purpose of this training is to inform the health benefit package committee members on the process as well as the evidence for the health benefit package revisions in Rwanda, and understand why this process is being undertaken at this point in time. And the other aim is also to equip the benefit package review members with the necessary skills as well as knowledge to take up their roles during the process of the review that is expected to take place at the end of this month, November 2022. And the training approach basically will entail the online, but in the end we are going to have the face-to-face class for 2 days. And the training will consist of 7 short modules, each lasting nearly about 30 minutes, including questions and clarifications. The training will be largely delivered online, sequentially starting today, which is Thursday, November 3rd, 2022. The training will be recorded and posted on YouTube, as I said at the beginning, so that committee members can easily consult these materials and read them. More readings will also be posted online, but members are encouraged to do self-learning, including other materials that may be posted, but also other evidences that they can find. So the weekly trainings will go until the first committee meeting face-to-face that I was talking about, which is expected to take place at the end of this month. And after that, that's when the committee will sit and do the evidence appraisal and prioritization of the interventions and services for the cancer interventions that we have started with. And throughout this training, we know that committee members are coming from different backgrounds, working for different institutions and organizations. And that's why at the beginning, I was asking where you come from and if you have attended some of these meetings, so that we can know how to gauge the depth of this training. And please, during the course of this training, feel free to ask questions. Feel free to stop myself or Rob when we are training to try to clarify a few things that you may not have understood. So that's the approach and the purpose. So I'm going to to give you the training plan, the schedule. The first one, I just introduced it, which is the purpose and the methodology for delivering this training. I consider that to be done unless you have questions. In this session, we'll also present why we have benefit package redesigning at this time in Rwanda. And this lesson will present basically the rationale why this benefit package design is being conducted and the process. This will be largely based on the concepts and evidence through the deliberative process. So it will be a process that has started until the end when the evidence appraisal will be done. And this session will explain the central role of legitimacy, which involves consensus building among different stakeholders, and the importance of the stakeholder involvement, which is building the transparency that will involve the 6 steps as will be applied to the Rwandan context. So for this day, November 3rd, we are going to present why we are doing this benefit package, and the process will be presented next week because it's a bit detailed and it's the first day. You've seen how things have become a bit disorganized at the beginning. So we want to present very few things, and next week we are going to present the process as well as governance. So next week, which will be November 10th, we are going to present the governance structure that most of you have seen. And as any other governance structure, the lesson will seek to describe the principles and concepts behind a good governance, especially during prioritization and decision-making processes. It will basically explain how different governance structures addresses different roles and responsibilities, and the decision as well as data in a transparency and accountable manner, drawing from examples from other countries. As you have seen from the previous presentations, a few countries have done this process, and Rwanda is following suit. So examples from other countries will be used in some aspects. And during that day also, we hope to discuss. No, we are not going to do mapping. Mapping will be done the other week. Sorry to include it here, but the mapping and selection of services for evaluation will also be done by outlining the purposes of mapping and explaining different steps to achieve the standard list and description of interventions that are appropriate for evidence collection. So this is a complex process that the assessment committee is doing, and we are going to present this again to the review committee to understand how this mapping process has been undertaken, to be able to appreciate that process, and it will be easier when they start when you start the review of the evidence. Under the mapping and selection of services, we'll also provide the short online of the new WHO tool for organizing and defining interventions, and how these link with guidelines. So this one will be delivered the other week in the week of 17th, and on this day also, they will define the criteria for prioritization of services, and this will aim basically at discussing the selection and definition of various selection criteria, such as the cost and cost effectiveness data, the catastrophic expenditure evidences as described in the ministerial instructions. And we also know why do we do decision criteria and how this may be used in this project. So this will follow the mapping, and basically different economic evidences will be presented to help define the criteria for privatization of interventions, as well as the services for the CBHI. On November 24th, we'll do the collection of the evidence on decision criteria for each service, which is the assessment. Sure. And this lesson will include discussion on the concept of measurements of the criteria in the ministerial instruction. It will also outline different ways to assess evidence on cost effectiveness in the context of benefit package. And this will entail discussions on threshold, the bookshelf for cost effectiveness and analysis. This will be seen in the next during the. Can we mute, please? Someone is talking while unmuted. And the last date will involve the prioritization of services. This will be key and very critical for the committee members. And the lesson will basically include, outlining good practice in the appraisal in terms of both process and forms. And in terms of processes, basically, it will outline the deliberations that I spoke earlier, and how it can be conducted to ensure that all the opinions are included from all the stakeholders, and this will ensure that transparency is taken care of. While in terms of form, it will involve examining, the areas such as the criteria that can be, weighted, because when we have different criteria, some can weigh more than the other, and how the budget constraints are also included in this priority setting process. So this is what we hope will be covered throughout this training, and from next week we are going to to start training, going into details from the week of 10th. That's all I have for the planning. But I have another PowerPoint presentation about why we are doing this this benefit package review. You see my screen? Hello?
Yes, we can see your screen, James.
Okay, good. So most of you have seen this PowerPoint presentation probably, and this is just refreshing to understand why we are doing this exercise at this point in time. And
James, we are still seeing the sheet on the training plan.
Oh. So I have to stop and share again. So I think I have to stop and try again. Do you see the screen now?
Yes, yes, we can.
Yeah, so I was saying that most of you have seen this PowerPoint presentation in the past in the past workshops, and we are presenting this to refresh our minds on why we are going to do the benefit package for the CBHI. As most of you are aware, there has been improvements at the primary care level, and there has been improvements in terms of attaining some of the indicators for the universal coverage, and most of these interventions that have led to that as a result of the CBHI, and sustaining these gains and those interventions will require some reforms. And based on the sustainability plan for the CBHI that was done a couple of years ago, three major components emerged as a way of sustainability, as a way of sustaining the CBHI approach. As you see, we have three columns here. The first column is about the strategic purchasing of services. The second one is about the operational efficiency. The third is about sustainable revenue generation. So we are going to focus on the first component, which is the service strategic purchasing of services, and specifically the explicit health benefit package. So in other words, what we are going to do is a result of the work that has been done before on the sustainability approach of the CBHI scheme, in which the explicit health benefit package redesigning came up as a major recommendation to sustain the CBHI scheme. These other components are also discussed in other areas. We've got two components here, the health service package as well as the health benefit package. And the way things are done currently, the health service benefit package as well as the health benefit package are kind of mixed up. So there is no orderly way of selecting services and interventions for inclusion in the CBHI services. For example, on the side of the health service package, a list usually meant to describe services that the government is providing or is aspiring to provide to the citizens is done mainly by the Ministry of Health, which is in charge of the population's health. While on the other side, in contrast, we have the health benefit package, which is basically defined as a list of services that the payer, which is the insurance, is willing and able to reimburse based on the set of criteria that maximizes health outcomes, given the available, set of resources. So, the current status is that both are being done in a disorderly manner, if I can term like that. And the role of this benefit package is to develop clear approach and methodology to define clearly the interventions and services for inclusion in the CBHI package based on the resources that are available. Still on the benefit package and on the service package, over the past, for those who are conversant with the way the CBHI has been functioning, there has not been any regular updates of the health service package, and the reviews and updates have been done when there is upgrade of facilities or new interventions, and this did not reflect the new evidence or the new technologies, which is the case with the CBHI benefit package. The CBHI, the health benefit package, for it involves the detailed review of evidence, including current technologies, but also the evidence that supports different interventions and services. And the benefit package, the other advantage of the benefit package is that it's done on regular basis. As more evidence comes in, as more technology becomes available, the review, becomes regular. The other presentation, the other slide is that the health service package is defined in broader terms, and this does not always, explicitly states what should be covered by the scheme given the available resources, meaning that the way things, the way interventions and services are included in the CBHI package is that there are many services and they don't take into consideration the available resources, whereas in health benefit package, it has to be informed by evidence, and you find that the services and interventions that are included are based on evidence because of the regular reviews that I also mentioned earlier. This is an example of another example that was drawn from Ethiopia. If you look at the breast cancer treatment stage 2, it's given look at the priority. It's given the medium priority, and this is drawn from the Minister of Health in Ethiopia, from the essential package of services. But if you look at the definition down, the extract from the DPC3, at this stage of the treatment of cancer, it says that treatment of early stage breast cancer is done with appropriate, multimodal approaches, which includes the generic chemotherapy with curative intent for cases that are detected by clinical examination at the centers and the first level hospitals. So the current assessment for the cancers, tries to look at different interventions for cancers, ranging from prevention to curative. There are different stages, and all these are taken into consideration during the review, so that the priority can be given, not the medium, but can be given a high priority, especially when it's at stage 2. So then why define explicit health package? So it is assumed that in this health benefit package, interventions that present best value for money will be identified to keep the CBHI members healthy within the available CBHI package. And there will be regular updates, to allow the package to adapt to the new technologies as well as the new evidence, for the new disease conditions, but also to match the CBHI revenues. The other advantage is that there will be, improved transparency and accountability because of involvement of different stakeholders. It's unfortunate that when we were starting this training, we didn't hear all the members, but the committee members are drawn from different disciplines to have enough representation of the stakeholders that we need to constitute this committee. So it's advantageous that when you have all this group, it enhances the transparency and accountability, and this maximizes the health outcomes of the CBHI members. This is the last slide, and it shows the important steps towards conducting the explicit benefit package designing, and the objective of the ministerial instruction that most of you have seen lays out clearly that a clear methodology has to be established to determine the CBHI health benefit packages, and this should be done through extensive assessment, providing enough evidence, economic evidence, feasibility studies and other forms of evidence, but also ensuring that we have the other group to approach the evidence that is presented by the assessment team. And that's why we came up with 17 member committee in charge of determining the benefit package. As I was saying before, the 17 member committee are drawn from different backgrounds to make sure that there is a clear presentation from relevant stakeholders. Can someone mute, please? Please mute. And the implication this will have to the CBHI scheme is that there will be now clear. There will be clarity between the health service package as well as the benefit package. The service package was previously provided by the Ministry of Health, but this case it will be provided by these teams based on the evidence. So it will be a win-win for the CBHI, but also for the Ministry of Health, and the objective and transparent approach to assessing what should be covered by the CBHI and for whom. As a result of the stakeholders that are involved in all this, this objective will also be attained quite easily, and the CBHI benefits package will be defined based on clearly defined criteria using evidence-based methodology that reflects, the national values and priorities. So it's hoped that at the end of the day, with the amount of evidence that will be used to choose different interventions as well as services for the CBHI, priorities will be identified because of the evidence, and this will also benefit the CBHI scheme, the CBHI members, as well as the Ministry of Health and other stakeholders that are involved in the implementation of the CBHI package. So that's all that we have today for the presentation. This PowerPoint was prepared for the, was prepared by the RSSP, and I thank them very much for doing this. And if you have any questions regarding the presentation, from the planning, the schedule we have, up to what I presented, please feel free to ask now. Hello, do you have any questions? Maybe if you don't have if you don't have questions, perhaps I can ask Rob if he's willing to give some brief overview on what I just presented, and some of the experience, especially with the process of this training that we are going to undertake, and especially the process, not on this PowerPoint, because the PowerPoint is more about Rwanda. We've seen it, but more about the slide that I presented earlier. Rob, would you like to say something?
Yes, thank you, James. Well, my name is Rob Baltussen. I'm Professor Global Health Economics, and good afternoon to all of you. My work is really on assisting and supporting ministries of health in lower middle income countries on benefit package design. And the work we do now in Rwanda is similar to the work we recently did in Pakistan, in Liberia, in Thailand, and in a range of other countries. And I'm very pleased to be part of this exercise. And what James has been presenting is indeed an important training element, because as members of the appraisal committee, you have a very important task. You're central to the benefit package design, because it's ultimately you making decision on what goes into the package and what will be excluded in terms of breast cancer control, in terms of cancer control in general, which is of course very important. And so in the next lectures, we will talk about what kind of information are we giving you? So what's the evidence we collected on cancer control, on the cost, on the impact, on the health effects, and also about the procedures during the meetings. So how do we think, based on the country experience in other countries, how do we think you can best structure your discussions, how to best interpret the evidence? There is some good evidence from other countries that this is best done in a stepwise approach. And so we walk you through this in the next few lectures. I think here I stop. It's a pleasure to be here, and we will see each other online, but also during the meeting on site in Rwanda at the end of November. Much looking forward to that. James, back to you.
Thank you, Rob. I'm not sure why we are keeping quiet. Members, you have no questions. I know you've seen this PowerPoint before, but maybe if you have a question in terms of the approach, the procedure, please, you are welcome to ask. So I think if there is no question, then I can discuss the next steps. It seems people are tired. We started late. Some came early, others came late. But I hope next time we are going to try to keep time so that we move at the same time, in the same pace. So in terms of the next steps, next week we are going to talk to, to also discuss about the process of the benefit package review, and we're also going to talk about the governance. The two items will be discussed. And I hope that by that time we are going to share with you the PowerPoints and the materials so that you can read ahead of time, so that you can come with some notion of what will be discussed. So whatever we discuss will be recorded, as I said in the beginning, and it will be posted on the YouTube. The link will be protected, and you will be given access to, to reach those materials. In addition to the recordings, we may post, other materials that might help to enhance the skills and knowledge for what we'll be training on. With that, if we have no question, I want to thank everyone for being here and apologize for the link that blocked when we started the meeting. And I hope to see you next Thursday at 2:30. Let's try to keep time so that we finish in time. We intend to spend not more than one hour of training, and let me hope that you keep the calendar so that we respect that time. Thank you very much. Thank you. Bye-bye.
Thank you. Bye.
Bye.
Thank you.
Thank you.